Brain development is a lifelong process and starts right at conception. However, the first 5 years are the period of rapid brain development. The brain reaches 25% of its adult weight by birth and 75% of its weight by age 2. The brain reaches almost 90% of its adult size by age 4. The critical period is a time when the brain is intensely adaptable to inputs such as new sights, sounds, tastes, and touches. If the brain for some reason does not receive the appropriate stimulus during this critical period to learn a given skill or trait, it may be difficult, ultimately less successful, or even impossible to develop some functions later in life. There are a number of critical periods in the first 3 years of brain development. During these periods, specific brain functions go through fundamental growth and formation. The months after birth, for example, are critical periods for the development of vision and hearing. The years between 3 and 4 are a critical period for the development of social skills. Language development is up to 4 years of age and starts to close at age 5. There are billions of neurons that feed to form vital connections called synapses. Those underutilized synapses will be pruned while strengthening those that are used consistently. Factors that affect these connections are genes, stimulation or environmental experiences, and nutrition. Genes are the hard wire responsible for forming all of the neurons and the general connections between the different regions. Stimulation shapes the developing brain. Repeated stimulus may impact the mental and emotional growth, and nutrition are structural components which aid in metabolic processes and plays a part in the formation and development of the brain. There's a concept called brain plasticity, and this has both a positive and a negative side. On the positive side, it means that young children's brains are more open to learning and enriching influences. On the negative side, it also means that young children's brains are more vulnerable to developmental problems should their environment prove especially impoverished or unnurturing. Malnutrition can lead to smaller brains. Poor nutrition may lead to inadequate brain growth, resulting to behavior and cognitive deficits, slow language and fine motor developments, lower IQ, and poorer school performance. Also, studies show that exposure to harmful chemicals such as pesticides will harm the brain and nervous system. Many of the processes that occur during brain development are vulnerable to disruption from pesticides. Exposure to neurotoxic pesticides during critical moments of fetal development has been shown to fundamentally alter the brain architecture. Parents should then give proper nutrition. In recent years, good nutrition also focused on food that is free of toxins and harmful chemicals. For infants and young children, breastfeeding is best because of its protective mechanism. And to be able to stay away from harmful pesticides and toxins, there is a great move now to use organic food. Researchers estimate that about 20 to 40% of cases of ADHD are not explained by genetics. Studies have found a variety of environmental contaminants, including exposure to organophosphates during pregnancy and in conception. In fact, there has been an exponential increase of cases of autism. In 2000, there was 1 out of every 500. And now it is 1 out of 63. So what could explain it? Then we know that it's something in our environment or maybe something that we're eating that may be causing all these developmental delays. Researchers also found that about 94% of the more than 1,000 children tested had detectable levels of metabolites. Children with higher levels of organophosphates, breakdown products in the urine, had a higher likelihood of having ADHD. researchers compared levels of organophosphate metabolites in the urine of children eating organic food with children eating conventionally farmed produce. It showed that those with organic diets had metabolites 6 times lower than those with conventional food. Other studies showed that when families shifted to organic diet, the metabolites had lower levels which were undetectable. The widespread presence of metabolites in children's bodies, combined with studies showing that changes in these levels are linked to dietary exposure, make a very clear case that pesticide residues in food are a consistent source of children's dietary intake of a mixture of pesticides.